Welcome to Manasik Shakti Foundation. The course is Mind Sciences for students, and we are talking about mental disorders prevalent among students. As we discussed, there are about 13 to 15% students who suffer from one or the other mental disorder at any given time, and another 10 to 12% are at a risk of developing some disorder in due course of time. We have an obligation to identify and provide appropriate intervention. But before we do that, it is important to understand how these mental disorders develop. Though precisely nobody knows what is the exact cause of mental disorder, but scientists and researchers agree and have a consensus that there is no single factor which is responsible for mental disorders. It arises because of combination of factors. And these combination of factors can be of biological nature, that means can be genetic or chemical, can be social in nature, can be psychological in nature, environmental in nature, or it can even be spiritual in nature. I would say that it's multifactorial in a sense. There is input of all these 5 factors in causation of a mental disorder. Also, I want to convey that mental disorders do not develop in a sudden manner. It develops amongst those who are at a risk, who have a long history. It develops over a period of time, and it has a lot to do with experiences in childhood development, emotional development, cognitive development, neurological development, personality development. So the development part is a protective mechanism which plays an important role for prevention of mental disorder. We would see time and again that those children who had healthy childhood, had good parenting, support, emotional care, are less likely to develop a mental disorder. Contrarily, those people who have suffered adverse reactions, adverse circumstances like poverty, isolation, discrimination, abuse, substance abuse or sex abuse, physical abuse, humiliation, hunger, frequent change of place, displacement, war, trauma, are at a particularly high risk for developing mental disorder when they become adult. The events from birth till age of 18 are extremely important to be taken into account, and we will talk in detail about these factors. There is a general understanding that consists that mental disorders are combination of factors. These combinations, some people, predominant contribution may come from biological factors. For example, those people who have a family history of a mental disorder. For example, if somebody's parent has a problem, or grandparents had a problem, or uncle had a problem, that child is more likely to develop a mental disorder. But having said that, chances of developing or not developing a mental disorder also depends upon environmental conditions. So, if the same child is again subjected to adverse circumstances or severe stress, he or she may develop the disorder far more easily, far more severely, and it may be far more difficult to treat. But if the same person goes through a healthy life, healthy childhood, healthy adolescence, healthy time in college, in universities, and is not subject of adversities, that person may not develop the mental disorder, or if he or she may develop just the precursors or some symptoms, some subsets of the disorder. He may develop the disorder but may remain fully functional. His life may not get affected due to disorder. But on the other situation that I described immediately before, if the disorder is severe, the conditions are adverse, the functioning in life and career pathway is severely affected. That's what we generally see. The first sign, the research suggests that first sign of mental disorders appear between the age of 14 and 17 years. So there was this experiment that at the age of 50, all those people who had a severe mental disorder and recovered well, they were asked the question, what was the age when you had your first sign observed? About 75% of these patients reported that they had their first symptom between the age of 14 and 17 years of age. And therefore, it brings me to state that students' life and adolescence period is a crucial period where either parents, teachers, or principals or fellow colleagues must have the ability to observe whether somebody is developing a disorder or not developing a disorder. Now, how do we provide this ability? Either by education or discourse, dialogue, workshop, whatever. But this body of knowledge should be there that there are symptoms of psychological functions, be it in the form of concentration, mood regulation, pain, or understanding, or mathematics, or intellectual ability, or thought process, or doing certain activity again and again, or ability to control your impulses, ability to understand things, whatever be the symptom. Everyone should know that these symptoms may cross the borderline and may become abnormal. So if there is a child in class 12 who says, I cannot concentrate, and he struggles and you don't find any reason why he cannot concentrate, one must check what is happening. Is he developing depression? Is he developing any intellectual problem? Or it is merely a manifestation of stress? What's going on? Is it a correctable situation? Or it can even come from any physical disorder. There are a lot of psychological symptoms appear because of physical condition, whether it is diabetes or a problem of thyroid or cancer or infection, even viral infections. They all produce psychological symptoms. You will find in your community, as doctors, we have seen number of subjects who suffered viral infection, sore throat, and about 10 to 12% of them develop severe depression. So physical disorders also cause psychological symptoms, and many times the psychological symptoms can be the first sign of a physical condition. And therefore, what I want to say that never ignore a condition which you have observed. Never live in denial and in a hope that it will not be there. If you find your son, your daughter, your friends, or colleague, or when you go to pick up children outside the school and you make an observation that somebody is appearing different, or you find lost, or you find any symptom that is suggestive of a mental condition, please do not sit on it. Communicate, speak boldly, discuss, find out more. That would be a great service that you can render to your fellow colleagues and expect the same from others. Mental health awareness is key to success for early intervention, early diagnosis, and prevention of all these disorders, be it in children or in adolescents. Believe me, all research data shows things have changed. When we intervene at an early stage, the outcome is far more better. When people report for treatment of depression, well within 2 months, 3 months, their outcome is fantastic. But if the same person comes after 2 years, 3 years, they receive more medication, recover much lesser, their quality of life remains much poorer, they take much longer time to achieve the same quantity of recovery than a fellow colleague. We'll continue to talk about psychiatric symptoms, diagnosis, causes, and prevention.